Hey everyone, welcome to This Explainer. Today, we're zeroing in on one of the most critical yet somehow invisible vulnerabilities in the modern managed care industry. I'm talking about healthcare data privacy failures. We're going to unpack the intense financial and legal risks that companies face when they drop the ball on protecting your most private information.
Think about it for a second. What actually happens when your most sensitive medical secrets are stolen? It's a pretty startling question, isn't it? As the threat of sophisticated cyber attacks ramps up year after year, the walls guarding our digital medical records are constantly under siege. And when those defenses fail, well, the fallout is massive. But who's ultimately paying the price? How do we even measure that damage? And how do investors and regulators hold these massive managed care providers accountable? To answer those questions, here is our roadmap for today. First, the health data threat. Second, high stakes and heavy penalties. Third, tracking privacy with SASB. Fourth, the information lifecycle. And finally, measuring breaches and losses.
All right, let's jump right into Section 1, the health data threat.
Before we can truly grasp the risk here, we have to establish exactly what kind of information is at stake. Corporate reporting standards draw a very clear, crucial distinction between general personal data and highly sensitive personal health data. Personal data is pretty broad. It's basically any information relating to an identified or identifiable living individual. Think names, addresses, or just a collection of data points that could eventually lead back to you. But personal health data? That's a completely different ballgame. This is a hypersensitive subset. It reveals your physical or mental health status and the specific care services you're receiving. It's literally the intimate reality of your bodily well-being. So naturally, it requires a completely different level of protection.
Which brings us to Section 2, high stakes and heavy penalties.
Understanding just how sensitive that health data is brings us directly to the very real, very intense consequences for this industry. Honestly, the critical nature of customer privacy and technology standards just cannot be overstated. When a managed care entity fails to develop the proper policies and technical safeguards to protect your patient health information against escalating cyber attacks, it's not just a minor IT glitch. It is a massive financial liability. A failure in data protection can trigger absolutely devastating civil and criminal penalties. The stakes literally could not be higher.
Moving right along to Section 3, tracking privacy with SASB.
If the risks are really that high, how do we track them? Well, investors and regulators need a uniform way to measure how well a company manages these exact privacy risks. To do that, the financial world relies on the SASB standards. These standards are now overseen by the IFRS Foundation and the International Sustainability Standards Board, which gives them immense global credibility. They are essentially the gold standard for corporate sustainability disclosures, ensuring that when a company reports on its data privacy risks, they're speaking a standardized language that investors can actually trust.
If you look at the SASB accounting table dedicated specifically to the managed care industry, there's a laser focus on customer privacy and technology standards, marked by the code HCMC 230A. This is exactly where companies are forced to lay their cards on the table. They have to disclose their policies, the number of data breaches, and the total monetary losses resulting from data security failures. It's brilliant because it takes an abstract threat like a cyber attack and forces it into a hard, quantitative metric.
Let's look at Section 4, the information lifecycle.
Obviously, before a breach ever happens, a company has to actively manage your data. Under the SASB standards, managed care companies must account for their handling of your data from start to finish. They have to describe this entire six-stage journey: collection, use, retention, processing, disclosure, and eventually destruction. The standards require companies to explain exactly how their practices at every single one of these stages might impact an individual's privacy. Do they need your consent to collect it in the first place? Are they selling it to third parties? How long are they keeping it before properly destroying it? Every single step is a potential vulnerability.
And to defend that six-stage lifecycle from cyber threats, companies are required to implement and report on three mandatory categories of system security. First up, administrative safeguards. These are the formal policies governing how staff actually conduct themselves with your data. Second, physical safeguards, literally protecting the physical computer systems and the buildings themselves from environmental hazards or break-ins. And third, technical safeguards. These are the digital processes put in place to authenticate users, utilize encryption, and strictly control access. If there's a weakness in any one of these three pillars, the whole system can come crashing down.
Section 5, measuring breaches and losses. Let's examine the hard metrics used when those defenses fail. Because despite all those safeguards, cybercriminals often still find a way in. When a breach happens, transparency is absolutely crucial. Under metric 230A.2, an entity must explicitly report its total number of data breaches, which SASB defines as unauthorized occurrences that jeopardize the confidentiality or integrity of an information system. But here's the kicker. They can't just give one big number. They have to break it down. What percentage involved just regular personal data? And what percentage compromised that highly sensitive personal health data? Finally, they have to reveal the exact number of unique individual customers affected in each of those categories.
It doesn't stop there, though. SASB doesn't just want a casualty count. Entities are also required to fully describe the specific corrective actions they implemented in response to the breach. Did they have to overhaul their management team? Did they change out business partners, update their employee training, or invest heavily in new technology? They basically have to prove to investors and regulators that they've actually patched the vulnerability rather than just issuing a PR apology.
And then we get to the ultimate financial reckoning. Metric 230A.3 demands disclosure of the total amount of monetary losses incurred as a result of legal proceedings associated with data security and privacy. This is where the theoretical risk of a cyber attack becomes a very painful reality right on the balance sheet.
So what exactly gets included in those monetary losses? Well, it encompasses civil judgments and massive multi-million-dollar settlements. It includes harsh regulatory penalties, disgorgement, and restitution. It even includes fines stemming from criminal judgments. But here is the really interesting part. The standards purposefully exclude the entity's own legal defense fees. By stripping out the lawyer fees, this metric isolates the pure, unadulterated penalty amount. It shows investors exactly how much the failure to protect patient data cost the company in hard fines and settlements alone. We've walked through the entire life cycle of the data, the strict security safeguards required, and the severe financial and legal penalties that rain down when a breach actually occurs. The SASB standards give us the perfect lens to see this hidden corporate battlefield clearly. So I'll leave you with this. As cyber threats continue to escalate in sophistication and frequency, is your managed care provider truly measuring up to these standards to protect your medical identity? It's a question definitely worth asking, because as we've seen today, when it comes to your personal health data, the stakes are undeniably absolute. Thanks so much for joining me for this explainer.